My first guest is Dr. Jennifer Ray, who is a colorectal surgeon with CSGA. So tell us what that stands for first.
Colorectal, Surgical, and Gastroenterology Associates.
Cover the whole GI tract.
Yes.
All right, colon cancer. You were telling me before we started, that's big in Kentucky.
It is. Kentucky has the highest incidence of colon cancer in any of the United States. So a real serious issue here for Kentuckians.
Well, who's at risk?
Certainly anyone is at risk for colon cancer.
I guess if you live in Kentucky, you're probably at risk.
If you live in Kentucky, you're at higher risk. But anyone at some point in their life will become at higher risk for colon cancer. So screening for colon cancer is indicated at age 50 for patients that have no family history of colon cancer or no family history of colon polyps. So the American Cancer Society just this summer recommended dropping that screening age that has been accepted for a long time to age 45 because of increasing rates of colorectal cancer in younger patients. So if you have a family history of colon cancer or polyps, you start screening at age 40. And then if you have a family history of colon polyps or cancer in someone younger than age 50, say you had a mom who had colon cancer at age 42, then you're indicated for screening 10 years prior to that age of diagnosis of the first degree family member with colon polyps or colon cancer. So
a family history at 42, you start at 32.
At 32, 10 years prior to the family member's diagnosis.
So you start anywhere from a young age, 45 to 50, but when do you stop, or do you?
Sure. So new recommendations from American Cancer Society this summer, when they dropped the recommended start age to 45, said after age 85 is when we say no more screening is indicated. But after age 75, the recommendation is to individualize the recommendation based on overall health status. So if you feel at 75 you're enjoying life, you're doing the things you'd like to do, and in generally good health, then it makes sense to keep screening.
What are some symptoms of colon cancer that you might think, oh, maybe I've got a problem?
Sure. So common misconception is that all bleeding, rectal bleeding that might be bright red or on the toilet paper is from hemorrhoids, and that's just generally not the complete case and should be discussed with a doctor. So if you're having bleeding related to colon cancer, then that sometimes can even be a late sign. So certainly changes in bowel habits are a red flag. If all of a sudden you were regular having bowel movements every day and then that started spacing out, or you generally had well-formed stools and now they're pencil-thin stools, so the changes in the bowel habits are something to pay attention to. Certainly abdominal pain, unexplained weight loss. If your doctor tells you, wow, Ms. Jones, you're anemic on your blood work, then that could be an indication that you're losing blood from a tumor in your GI tract. But we like to get to prevention of colon cancer before any of those symptoms arise, for sure.
There are also some things like people born in certain years are more likely to have it, smokers, obesity. Are there risk factors that may play a higher role?
Sure. So there are risk factors that we can modify. So we have some control over quite a few of the risk factors. So having a sedentary lifestyle, not getting enough exercise increases your risk. Being obese, overweight increases your risk. Smoking is a big one. Certain races, African Americans and Jewish people of Eastern European descent are at higher risk. So your race you can't modify, getting into the unmodifiable risk factors. So your age, the incidence increases as you age. You can't modify that. And family history is a big one that'll increase your risk.
Okay. So let's talk about screening methods. There's obviously the colonoscopy, and you can tell us about that, but there's the Cologuard now. Contrast the two for us.
Sure. So certainly the best colon cancer screening test is the one that gets done. We're seeing a high rate of colon cancer in Kentucky, and we want people to get screened. So decreasing barriers to screening is important. So the stool-based tests, as you mentioned, one of them, Cologuard, has become very popular, helps people that have some barriers to getting to a colonoscopy procedure. So that's one. It's a home-based test, so it's easy to use, simple instructions, and it can be done in the privacy of home, no time off of work. The shortcomings of the Cologuard test, one being that it's not indicated for everyone for screening. It's only indicated for 50-year-old or older for average risk. So that means no family history of colon cancer or polyps, and certainly no symptoms. So if you're having symptoms, you're not indicated for those stool-based tests. So the Cologuard finds about 92% of colon cancers, and we'll find a little over 40% of colon polyps. Colonoscopy is a gold standard exam for colon cancer screening and remains at the top of the list for recommended tests for screening for colon cancer. It's going to find nearly 100% of cancers and a little over 90% of precancerous polyps. So,
And if you're there at the time of the colonoscopy, you can actually take the polyp out.
take the polyps out, which is what decreases your chance of developing cancer, and we know from long-term studies decreases the chance of you dying from colon cancer. So it's very well studied long-term.
It's great information. Thanks for coming in.